I just learned a staggering number. There's over 30% of real estate agents in the United States that do not have healthcare coverage. That's a lot of people. And if you do have healthcare, you understand the cost of it. So in this video, Margot's going to go into detail about the plans that Clearwater Benefits provides the agents, brokers, and staff members at eXp Realty. And if you're watching this video and you're an agent and you're not at eXp and you're curious about how it works, you can definitely reach out to Margot and she'll go through that personalized plan with you as well. But just know that this health insurance is only available to the staff and agents and brokers at the company. So I hope you find the information in this video valuable. So let's just jump into it.
Okay, well, hey, let's go ahead and introduce our first special guest here. We've got Margot Wickersham. She is the Senior Vice President of Strategic Partnership Clearwater Benefits here. And if you guys don't know who Margot is, she's got an amazing story herself. And she is here to spend about 25, 30 minutes or so kind of going over the Clearwater Benefits. If you guys don't even know what this is, guys, definitely take a look at this, listen to this, put your cell phone down, take some notes here because this is definitely a wealth of information. I know the owner, Jason, very well. His family owns Clearwater. If you guys know Jason, he used to own a mortgage company up in Dallas, Oak Mortgage. He actually was kind of my first mentor whenever I got into the business 10 years ago. We did some masterminds up there in Dallas, and he kind of helped me kind of get my mind right in regards to growing a business. And so he's an amazing guy, and his family is an amazing family as well too. And they are here to help us out. They're here to help us with our benefits. And I actually switched over. I'm actually going to be switching over. I actually just got a rate increase from my health insurance, and I actually picked up the phone and called Margot last week, and I said, hey, listen, I want to see if I can get a quote and be a testimonial as well for Clearwater, and I want to see if you can help me save some money. And I got a call this week on Wednesday that I'm going to be able to save over $250 a month with a better policy, guys, better policy, right? And so it's a win-win. So shop around, guys. This is the time. I know you guys are probably getting all these text messages and phone calls about all this health insurance. I know it's crazy. But guys, this is an exclusive partnership and a relationship with Clearwater and eXp, right? And I know what Jason and Glenn Sanford, they've been doing a lot of masterminding together as well too. And I'll let Margot kind of share a little bit about that. But these are two brilliant guys getting together in a room and helping us out. So without further ado, Margot, take it away. Welcome to the call. How are you?
Oh, I'm awesome. It's so good to see everybody. I see names I recognize and a lot of new ones as well.
Happy New Year. How are you doing?
I'm so good. I'm so good. I'm excited about the opportunities. It's been a wild year, and it's also going to be a great new year. I have great feelings of prosperity and success. And one of the things I want to share with you is, let me share my screen if I can.
Share your screen. Margie, you got about 25, 30 minutes or so. We'll open up for a few questions. Then we have our last special guest, Brent Gove, is going to be firing us up for about 10 or 15 minutes to end the call. Yep.
I have to go before the great Brent. Thanks.
Yeah. Well, you know what? He can only come on at the end because he's actually in at an event in Atlanta with a bunch of agents, and so he actually moved his schedule around, his speaking schedule, so he could hop on the call and fire us all up. And so awesome. I'm forever grateful for that. But no, you got awesome. You go ahead. You got about a good 30 minutes.
Want to show you this picture that Jason Sherman sent me from Monday. He was at the bell ringing on the stage.
I saw that. Yep.
Yeah, with I call him Jason Squared, Jason Guessing, Jason Sherman, just Jason Squared.
There you go.
And Glenn, and yes, big exciting things are going to be happening soon, and that's all I can say about that. I'm going to share my screen now to show you. Hopefully, you're seeing the little slide deck where there's a picture of me wearing blue. Y'all see that?
Yep, I can see it.
All right. Okay. What you said, Pat, is so true that there is no time like now to take a look at your healthcare plans. And even if you've had a consultation with our team before, it's a good time to look at it now because we have just rolled out brand new plans, additional new plans. In fact, we saw some areas where we really wanted to improve what we deliver as far as plan options, benefits, where we could reduce costs, where we could improve service. And we worked with our partners to get them up to speed. We said, this is what we need you to do. They didn't do it. They didn't step up. So we formed our own companies. That's what we did. So now we have a variety of plans that we've never had before. And it is a massive undertaking to create new insurance plans, and not sexy at all. But for those of us who are in the health insurance space, we think this is awesome because we're kind of nerds for this stuff. We're subject matter experts in all things healthcare, and we want you to lean on us, leverage our team, our time. You don't want to go become an expert on any of this kind of stuff. And there's so much you need to know. And the terms are confusing. They're words you know, but the meanings are fuzzy. So I am going to just jump in right now. Feel free to pop questions into the chat, and I will get to them as we go. All right. So what we know is about 30% of agents don't have any health care. Of course they don't. It's so expensive and it covers nothing in many cases. So we're wanting to get it to where you don't have to choose between your health and your wallet. So what we do is have three primary goals. We want to save you on the fixed cost. That's the monthly premium. We want to upgrade the access that you have to doctors and hospitals because it matters. And I have a story I'm going to share with you. And if any of you have stories you want to share, pipe in, and I'll be glad to give you the mic for a minute, because nothing is better than hearing directly from agents who have the experience. And we also want to reduce the risk you have of out-of-pocket expenses when you do have a big need, like an emergency, or like a cancer battle, or just a visit to the ER. That's where the expenses really come in. What we know is that 2/3 of bankruptcies in this country are caused by medical bills, and that is just not right on so many levels. So those are the three goals, and the way we deliver on those three goals is to give you a variety of options and resources to help you find the best combination. So we've got eXp Agent Healthcare Solutions that include health insurance. Think of it as two programs: health insurance for doctor visits, and then medical cost sharing for the big expenses. That's the kind of plan that I'm enrolled in. And if you've been around a while, you may have heard me share my story, and I'll share it with you here in just a couple of minutes. It saved my life. I will not bury the lead. It saved my life. I did not know my life needed saving, but it saved my life. So the plan matters. Going to see the doctors matters. Then we've got another set of plans that are traditional health insurance, that this is where we have formed two separate sets of plans and companies so that we can deliver on a variety of options for you. Why does this matter? Because if you have a pre-existing condition, like let's say, just going to pick this out of the air, let's say you had arrhythmia in the last year or so, well, you're going to have limitations on care that is reimbursed or that is paid for on the medical cost sharing side of things. So we don't want to put you in a plan that's not going to serve you if something comes back and you need to deal with it. So we want to find the right combination for you. And of course, you can always add dental, vision, critical illness, disability, supplemental plans that give you some cash back when events happen that are qualifying. So think AFLAC. So those are all options. So wide variety of options. And then I think one of the most valuable things we do is, you might be going, super cool, Margot, how on earth do I learn how to decide which plan's best for me? Well, that's where our team comes in. They are amazing. It's complicated. It's really complicated. And so we've got this team of experts. Most of them have been with us since the first year. Actually, we started partnering with eXp way back in 2019 at eXpCon. I think there were 22,000 agents then. And we've had a blast growing with you guys, and we've grown tremendously as well. And we've all learned a lot. But we have this team that is very well-versed, very educated. They're also very empathetic. They're very kind. They are not hard sell at all. We won't have that. So what they'll do is spend some time on a Zoom call with you, ask you a few questions, and understand where we need to focus your best options. So because you don't want to learn about all 10,000 plans, you want to just focus on the ones that are the best fit for you. And if you happen to be on a plan, let's say through a part-time job or a spouse's job, or let's say you're retired military and you're on TRICARE. Well, we know nothing beats TRICARE. If you're retired military and you're on VA, we can do better than that for you. So it just depends. But if you happen to have a better plan, that our team will always say, you know what, we recommend you stay there. Nothing is better than that. When that changes, give us a call. We'll reevaluate. And we do that all the time. So we love being available to you. We do have a website. I'll share it with you. And you can check it out here after our amazing call. So you've got these 3 sets of plans. You might be curious, what do most people choose? Well, about 85% of them choose the Clearwater solution, which is the combination of health insurance and medical cost sharing. And then about 10% choose the major medical, and about another 5% we will say you need to stay right on that plan. It's really best for you. So there's new plan upgrades. This is a slide that shares with you average annual savings. So it just depends on where you start. You know, states like California, New York, New Jersey, Oregon, California in particular have very expensive health insurance rates. So you see higher savings there. But $8,000 is the annual average. I'm in Texas. I'm in Austin, Texas. I'm married to a retired school teacher, and our savings to move the family from retired school teacher, good insurance, to the Clearwater plans, we're saving $7,800 for the family a year.
Wow.
It's crazy. It's insane. It's the most irregular, bizarre, random industry I've ever seen. And we can talk about how that got to be, why that got to be, or what to do about it all day long. But at the end of the day, Clearwater is doing something about offering valuable options to you guys. And I highly recommend you take us up on the offer. Also, by the way, do you think this is valuable for attracting agents?
Yes.
Heck yeah. All right. So there's all kinds of options. We've got increased sizes of, I'm not going to go into that. That's too granular. So you've got some perks that I especially want to share with you. One is Teladoc. Raise your hand if you have used Teladoc anytime in the last 3 years. If you've had to do primary care, that was pretty much the only way to do it for a while. Well, this is unlimited, any state. That's nice because most plans are very regional. So if you are in Texas, let's say, and then you travel to New Hampshire, your plan isn't going to work for you there, more than likely, but not on the Clearwater plans. You don't have those limitations. There's 32 Blue Cross companies in the US, regions, and they don't play together. So it's really annoying. So I love that we have erased the state lines and we make this available to people when they're wherever they are. Expert second opinion, y'all, this is what saved my life. So it was March of 2020. And I was getting my second opinion at MD Anderson, which is about 3 hours away. Now, March of 2020, there was a little something brewing and called COVID. It was just starting to come along. We're all going, scratching our heads going, what? That's not going to come. Oh, it is here. Okay. And my doctor's he's the rock star of bladder cancer. His name is Dr. Ashish Kamat, and I could not think more highly of him. He's an amazing person. He said, well, if you go with the treatment plan that your Austin, Texas doctor recommends, you will be dead in 12 months. Dead.
Jeez.
Bladder cancer no kind of cancer runs in my family, plenty of other stuff, but not that. I've never been a smoker. Well, except for when I went to a Styx concert in the 9th grade. You know, I may have tried cigarettes then, but it's typically associated with smoking, and I haven't. I had I'll do the healthy lifestyle arrangement with cancer and you leave me alone. Guess I didn't get it to sign the contract because here it came. Sometimes it's just random. But I had 2 kinds of cancer. Did y'all even know you could have 2 kinds?
Nope.
Yeah. I thought, oh, that's just like my body to try to be all type A, overachiever, even with cancer. The second form of cancer does not respond to the first kind's treatment plan. So we would have killed one kind of cancer and the other kind would have killed me inside of a year. 57 years old, I wasn't done. So I did all the things, and it was lose your hair chemo and all of that. It was 3 nights in the hospital, 4 days every other week for 8 weeks by myself, because by then we were in quarantine.
Wow.
And my husband would drive me up to the door, kiss me through a mask. I'd go in with all the other sad, lonely cancer patients trying to get their lives saved. And then he'd pick me up and I would just crawl, exhausted and drained, because that's terrible chemo, and then just sleep for 2 days. We did that for 8 weeks. And then I had major surgery and they rerouted plumbing. I'm good to go. Just found out I'm cancer free Tuesday. Woo!
Congratulations. Yes.
So awesome. Because I got a second opinion, because I could go to the best doctors. The doctors matter. They matter. So you don't want to go to Bubba's pretty okay drive-through cancer clinic when you've got something serious. You want to make sure you go to the best. So this is some advice I share with you, no matter whether you ever call us, have a consultation, or look at the website. You get a diagnosis, go find the best doctors you can, because it matters. Also, time is not your friend when it comes to healthcare stuff. There's kind of a, we'll keep an eye on it. And I was told that actually by one of my local doctors. Well, let's keep an eye on it. I thought, nope, I'm not doing that. So be your own advocate. Go check it out. What's the worst that happened? They go, yeah, you have nothing. Great. That's great news. But cancer gets worse and the outcomes get way worse as time goes on. Get it checked. That's my PSA for today. All right, so it saved my life. I'm here to tell you that story. And oh, by the way, and this is just an asterisk, I'm out only $1,500.
Wow.
It was about $400,000. Yeah, makes a big difference. So open network, you can go where you want for some, and then you've got a PPO or a broad network for others. No enrollment deadlines. And what I mean by this is if you are on a plan or not on a plan right now and you want to enroll, you can enroll in our plans any month of the year. Open enrollment right now, I think it ends this week, is for the plans that are on the exchange. So if those are the best plans for you, then the deadline is relevant. Otherwise, you have flexibility. Why is this important? Well, it's important for you, if you haven't already, to schedule a consultation. And I am going to share a link with you that you can use to book a call. And let me do that before I forget. I know I'm bouncing around a second.
No, you're good. Wow, that's an amazing story, Margo. That's wow. Talk about life-changing. Geez, that's truly life-changing right there. Yeah.
It was, and I was already optimistic, enjoy the moment kind of a gal. But that really, really taught me to make the most, to savor every moment. Nothing is guaranteed, nothing.
Right.
I've been through some stuff besides that. And now I am just grateful for every moment, most of the time. Every now and then I have to talk myself back into it, but mostly it is easier to remember the purpose of life is to enjoy the people that are around you and give back where you can. I will handle the link here in a bit because the link is not popping up and I'm not going to wrestle with technology.
Yep. No, you're good.
With your time. So we've got new upgrades that deliver you a lot of value. There you can pick your deductible annual max and look at these numbers. They're much lower than most insurance plans. 1,000, 2,500, 5,000. And of course, that's like a slider. So the lower the payment, the higher the deductible and vice versa. And those are choices that you have. So we've got a lot of happy, true stories. I just shared mine with you. Yep. And there's the picture, Joe. I wanted to show you. No, it really happened. My hair used to be way long. And that's what it looked like in April of 2020. And man, that I did not welcome that look. And then growing it back out, that's not fun. And so I actually liked it best there with really short or back to long. But here I am, I've got a full head of hair again, and I'm super happy about it. Not that it's the only thing, but it is a thing. Do other brokerages offer anything like this? Nope. So we've got an exclusivity agreement with you guys. Use this to attract more agents. You can use, and we've got all kinds of assets for you. We've got slides, we've got social media posts, we've got content. We can schedule presentations like this one. If you want to host an event and bring agents, we can come and, oh, there we go. Book a call. You don't even need my link because it's right there. You can point your finger at it.
Yep.
And you guys can you can schedule that for next week or whatever, and then it's done. And that's what I recommend you do. And that way you're taking care of yourself and you're checking the box. So I just shared a lot of stuff and my own story. And at first I didn't share it because It was hard, but then I realized that connecting a real experience with what this product, this suite of products is so important to help you see. And so I actually wrote a book about it and it's on Amazon if you want to go find it. Gratitude in the storm when not dying is enough to keep fighting.
Wow.
So questions.
Yep. That was awesome. Yeah, open up for questions, and then we'll get to our second special guest here in just a second, though. But wow, that's good stuff, guys. And I know there's a lot more testimonials. I actually love. Well, Margo, I love your testimony. That's truly life changing. And then Beth Silverman, she's got an amazing testimonial. I've spoke with her on stage before, and she shares her testimonial, and it's just truly amazing. I mean, guys, these are agents in healthcare. Changed their life, and without it, I don't know where they would be. It would be very sad. And so. Guys, you got to take this seriously. And there's a lot of agents out there that don't have healthcare. They don't have insurance, and it's very dangerous, very scary. What if something happens to them? And so this is a great way for recruiting. This is a great way to attract agents and talk to them about healthcare. Bring it up first, and then obviously all the other added value benefits of what eXp has to offer. But this is absolutely amazing. So Margo, great job. I love it. I love it. Yeah. Let's open up. Any questions for Margo? And actually, anybody on the call right now that is actually on Clearwater Benefits right now that maybe wants to share a success story about
Jeff Russell is.
Any save. What? Say it again.
Jeff Russell is. He chimed in.
Oh, Jeff. Jeff, unmute yourself. I want to hear your story. I haven't heard it.
My story is basically I had Kaiser, and I was paying about $952 a month. I had the best insurance they offer, but it was $950, whatever. So I started Clearwater, Kelly and I, like 3 years ago, right after I joined eXp, and my premiums went down the first year to like 400 and something, which was a huge savings. Now it's at 350, and my insurance coverage is just as good as it was at Kaiser. But now I can go to any doctor I want, and I've got teledoc and all these other things. So really, it's much better than what we had at Kaiser, and we love it. And I've used it for. I've had a couple minor operations and stuff, and it's been awesome.
Love it. Great testimonial.
That's
is awesome.
So great. Thank you for sharing, Jeff. Yeah.
Sure.
There was a question about sharing the cancer bills, and yeah. So the big, think of it this way: the big bills are handled through the sharing if you're on that plan, and your doctor visits and diagnostics, those things are handled with an insurance company. And actually, the insurance plan part of that package of plans is full, but it has a high deductible. So what we do is just add extra on top of it. We add a medical cost sharing plan on top of it, so you don't have to go out of pocket as much before you start to get some relief. So
Love
I
it.
wanted to address that.
Love it.
Yeah.
All right.
Looks like somebody wants to copy the slides. Yeah, let me get you drop them in here. I'll do
any
that.
Any other questions for Margo? This is good stuff. Yeah, definitely book a call. Screenshot that.
I have a question.
Yep, go ahead.
So the Clearwater solution, that's like a sharing thing you're saying. As I'm really wondering, like, what's really the difference between a Clearwater solution and a traditional health insurance?
Right, it's a great question. I think I just put the slides in there. I think.
Oh, thank you.
Yeah. So Clearwater, we're the broker. So we are licensed in all the states, and we bring a variety of different plans. As far as I know, they're all available in all the states. That's really important and not easy to do. So we have our own plans that we've created because we were working with different carriers, and we found that we could continue to find newer, better carriers. And then there was a ceiling that we got to where we couldn't get them to do what we wanted to do. So we have formed our own companies. Names you'll hear are like Boomi. And so there's now a variety of different plans, but they're all things that we can control. Your point of contact is through us, your billing is through us, and before it was different companies. So this is a better overall solution for you guys. And the difference between medical cost sharing and insurance is that medical cost sharing was grandfathered into the ACA back at whatever year that was, 2010, 9. And because they've been around, most of them were through ministries like Samaritan. But it's basically like everybody is putting money into a pot and agreeing to live a pretty healthy lifestyle. And when there's a need, then the community pays the bills. And one of the ways they're able to do that and for it to work is that they negotiate with the providers. There's so much fat built into insurance, as you know. Humana, anybody want to take a swing at what percentage their stock price has gone up since ACA? What percentage? Guess high. Anybody? No?
I have Humana.
3,000%.
Wow. That is crazy. That is crazy. All
So
right.
there's room.
Yep. Yeah. Well, yeah. All right, guys. So we've got our second special guest here texting me right now, and he is anxious to energize us all. Margot, thank you so much for that presentation. That was absolutely amazing. Get with Margot, guys, and definitely if you guys want to get a comparison, get a quote, definitely do that. I did it. I'm saving some money. I'm super excited now that I've got a testimonial that I can actually say that I actually saved $250 a month for my other provider. Now I'm with Clearwater with better coverage, right? And so definitely take a look at that. Margot, thank you so much. And if you guys have any questions for Margot, get with her. You can actually hit her up on workplace chat as well, or send her an email or whatnot. But Margot, thank you. I appreciate it. Good to see you as always. Happy New Year. Thanks again for your time.